from a company standpoint, I think when you look at the amount of activity, conversation, and presentations around the use of interferons in the hematologic malignancies, and more specifically in the myeloproliferative neoplasms, it has been rather extraordinary. We can start off with Dr. Jean-Jacques Kalajian's presentation on 7-year follow-up data from the continuation PV study. And what he demonstrated rather clearly is that ropeg interferon alpha 2b, or Besremi as it's known in the United States, can treat a patient with PV regardless of where they are from a risk perspective, and that's a thrombotic risk perspective. So whether they're low risk or high risk, ropeg will actually be a drug of choice to treat these patients, since you get a very high hematologic response. And not only is it high, but it's very durable. So these patients are going to be treated 5, 10, 15 years. So obviously you're going to want to have a drug that works for 5, 10, or 15 years. And Jean-Jacques' presentation and data clearly demonstrate that. Then when we go and we move into the next topic, which was discussed quite a bit, and this is around dosing. So we're actually, obviously we had some very impressive results with our PEG and Vera and with our PROUD and continuation study. But there's been this hypothesis that if we dose a little bit more aggressively, especially in the titration phase, that we can have a more deep and durable response, especially as it related to not only complete hematologic response, but the allelic burden or the disease burden, however you want to look at it. And what we've seen in presentations from our Pharma-Centric China group and our Pharma-Centric Korea group, we have seen preliminary evidence that demonstrate that when you dose a little bit more aggressively in the titration phase, you can actually drive down the CHR much more rapidly, so you're seeing more responses in the 12 to 24 week frame, but you also see a rather dramatic decrease in the allelic burden. And that's an implication, or indicates, that actually when you do this different dosing regimen of 250, 350, and 500 within a 4-week treatment span, you get quite an impact on the allelic burden. And to us, that is an indication of the drug's potential disease-modifying effects. And that brings me to the next point. When you looked across all of the presentations that were given, one of the things that people have been emphasizing was not only the hematologic responses, but also the allelic burden responses, i.e. what's happening to those JAK2 mutated stem cells in the bone marrow. And the data has consistently shown that ropeg can decrease that quite a bit. And that's where we're excited about demonstrating a potential disease-modifying effects of ropeg. Other classes of drugs, JAK inhibitors, drugs that look specifically at hemoglobin or hematocrit counts, actually are not doing that. And that's why we're very excited for ASH 2023, where a lot of this data that I just mentioned will actually mature and we'll really be able to see the true disease-modifying effects of ropeg and Besremi in patients with MPNs.